you for coming along to today's panel discussion on children's access to healthcare and the NHS backlog. My name is Tom Gardner, I'm a member of the Fabian Society's Executive Committee, and I also want to say thank you to the Faculty of Dental Surgery at the Royal College of Surgeons England for convening this discussion today. If you want to tweet, then please tweet hashtag #lab22, so LAB22, so we can keep those conversations going on Twitter. And we have a brilliant panel today with a range of expertise. Camilla Kingdon, who is a consultant neonatologist and president of the Royal College of Paediatrics and Child Health. Wes Streeting, MP for Ilford North, Shadow Secretary of State for Health and Social Care and former Shadow Secretary of State for Child Poverty. And Matthew Garrett, who is Dean of the Faculty of Dental Surgery. And hopefully we'll be joined by Aletha Addy, who is political correspondent at The Mirror. So just to set the scene with a bit of context, this summer, 370,000 children and young people were waiting for consultant treatment on the NHS, up 100,000 from the year before that. And these waiting lists are a particular issue for children and young people because of the impact it's having on their development and education. So today we're going to explore how we got ourselves in that situation, how we might begin to turn the tide, but also think about the bigger question of how we can improve our services, improve our society, to reduce ill health amongst children and young people. So we'll have opening remarks from each of our speakers for about 5 minutes, and then we'll move to Q&A, which we'll do in batches to give you as much time as possible to ask questions of our panel. So without further ado, Camilla, I'll hand over to you for your opening remarks.
Thank you very much indeed, Tom. So it's great to be here. I think I'm going to start by just giving us a bit of context here, which is that children's health in this country, while we've made dramatic improvements since the 1950s, the rate of improvement has slowed, and really concerningly, by some measures, for instance, infant mortality rate, which is an international comparable marker, actually our rates of infant mortality have started to rise, and that was from a kind of 2015. So this is before the pandemic. The situation for child health in this country was already deteriorating. And then if we layer on top of that the impact of the pandemic, I think it's quite easy to see why we are now in the concerning state that we are in. Now, mercifully, children, as you know, were to a far lesser extent affected by the virus that was COVID. But what we have failed, I think, as a society to recognise is the wider impact on children. So the impact of lost education, which we know directly relates then to health outcomes and life chances, and impact particularly on mental health. So I think what our concern is that we are essentially in a situation where there's likely to be a generational impact, which if we can't start turning it around at pace, will translate into future generations in terms of our society in this country. And of course now we've got a cost of living crisis layered on top of that, which I think certainly for us as paediatricians is extremely concerning, because children tend to be at the sharp edge of situations that we currently find ourselves in. To get to the point around the waiting lists, I think your figure is absolutely correct. Even more concerning, though, is that the rate of rise of hospital waiting lists is now more than double the rate of rise of adult waiting lists. And that's when we were talking about the hospital sector. We have no measure of what's going on in the community, either for community child health, which looks, for instance, particular things like autism assessments and some of those kind of community-based assessments, and then also crucially therapies. So we know speech and language therapy, physiotherapy. We have no idea how big the waiting list is, but almost certainly it measures hundreds of thousands of children waiting, with a lot of geographical variation. So, to sort of give that a bit of flavour, a child at 3 who is in need of speech and language therapy, if that's delivered in a timely way, that converts to a child who's ready for school at 4. But clearly if it's not accessible, which actually is currently a big, speech and language therapy is a big problem in this country at the moment, means a child not being ready for school. We're hearing from teachers about what that actually means and how long it takes to help a child catch up. And the same is true for mental health. School nurses were really good at detecting anxiety and sort of low-grade mental health problems early on. Being able to intervene when it's at that kind of early stage is the difference between keeping a child in school versus major self-harm, major mental health problems, and long absences from school. So early intervention for children is absolutely key, and we're now sort of stuck in the spiral of not being able to kind of do that. So what are the solutions? Well, I mean, the first thing, and everything we've been to in relation to health in the last 2 days starts with the workforce. But actually, I think for child health, this is more than doctors. This is about thinking about the wider workforce. A third of health visitor posts are empty at the moment. School nurses are actually vanishing. There are fewer than 1,000 school nurses left in England. So actually, we've really got to have a whole-scale think about the workforce that delivers for children. That's the first thing. The second thing is we have to lever the advantage that the Health and Care Act could potentially give us. Integration for children is vital, and we've always said this integration between primary and secondary care, integration between physical and mental health. That's where you lever your improvements for children. So we have to maximise what the Health and Care Act can deliver for us. Thirdly, prevention. We have to invest in disease prevention. If we want to create healthy, functioning adults for the future, we actually have to think about what we're doing right now. So we want to see the health disparities paper published. We want to focus on obesity, and particularly from a child health perspective, we would be arguing about the ban on junk food advertising in the pre-9 p.m. watershed, because there's evidence that you can, from a child perspective, that you can alter behaviour around that. And then we want to refresh the vaccination strategy. It's embarrassing how poor our routine vaccination uptake is now. Measles can be prevented with 2 doses of MMR, and yet we are desperately worried about measles outbreaks going forward because of our low uptake of MMR. And then finally, data. Without data, we cannot understand the size of the problem, and then we can't measure improvement. So children fall foul of this because because children's health and well-being sits within health, social care and education. Without a single numerical identifier that can track them across all three, we're never going to be able to kind of lever improvement. And in areas, for instance, like Bradford, where they're using data intelligently, they can actually target interventions based on data linkage. So that would be my final point.
Camilla, thank you so much for a really comprehensive overview of the situation we find ourselves in, drawing attention to the importance of the social determinants of health, and also those hidden waiting lists that you referenced as well, but also for setting out that framework for improvement. That's really useful. Thank you. Matthew, I'll go to you next.
Well, thank you very much, Tom, for chairing this event, and also to my fellow guests for coming to talk about this very important topic today. The Faculty of Dental Surgery is a professional body which is housed within the Royal College of Surgeons of England, and we represent about 5,000 members committed to maintaining excellence in practice and patient care. You might think it's a bit strange for a dentist to be sitting here talking about health inequalities in children, but tooth decay is the most common disease in childhood, and it's consistently the main reason why a child between the ages of 5 and 9 is admitted to hospital. And tooth decay, on the whole, is entirely preventable. It's hitting those from deprived areas much worse than others. And in fact, our members can tell you which postcode a child comes from, dependent on how many teeth they need to be extracted. 5-year-olds from the most deprived areas experience 3 times the dental disease than those from affluent areas. And the gap has widened since 2017, and these figures are unacceptable. Even before the pandemic, children's oral health was bad, but following dentist closures, difficulties in accessing appointments, maybe snacks, homeschooling, all that sort of thing that we're all guilty of, together with consistent poor oral hygiene, has made things much worse. In fact, 350,000 infants missed their first dental checkup, which has been reported and 760,000 fewer 0 to 17-year-olds saw a dentist during that period. So what we believe at the Faculty of Dental Surgery is that the mouth should be put back into health, and that oral health should be given a higher status across healthcare. Dentistry isn't just about fillings. Dentistry is much more than that. It's much broader than that. It's about oral health in the widest sense. And pain and extractions that these children face are having real consequences for them. So difficulty eating, difficulty sleeping, difficulty socialising, difficulty with school, concentrations, etc. So we need to do more. You know, if you ask the general public out there, what is the most common reason for a child to be admitted to hospital? Would they tell you it's to have their teeth taken out? Probably not. So we understand that there are lots of ongoing issues within the NHS. Lots of those issues have been highlighted with Camilla. Lots of those issues translate into dentistry as well. But what we need is targeted prevention strategies in England. There have been examples of good practice, particularly in Scotland and Wales, where they have targeted toothbrushing sessions for appropriately aged children in schools. We don't have that in England. So I think that's something that is worth considering. We also need a workforce strategy for the whole dental workforce, so that dentists can be trained and located in the areas in which they're needed. Not just dentists, but the whole dental workforce needs to be incorporated into this issue. But also midwives, health visitors, social workers, teachers, pharmacists, school nurses. Everybody has a role to play. And at the moment, I think that oral health isn't given the sort of what it deserves. So it needs to be given status across the professions, and also oral health should be seen as an essential indicator of children's inequalities. So to conclude, what I would say is that we need to raise the status of dentistry within the NHS. We need to put the mouth back into health so that children can grow up in a fair and equal way.
Thank you so much, Matthew. And I think having a dentist on this panel is, as you say, essential. It is an area of policy that is neglected. So to have those insights, particularly on oral health inequalities and how that relates to staff distribution as well, is really insightful. Wes?
Thank you very much. I'm so sorry I held everyone up with my incompetence of going to the wrong museum. Please don't tell Keir Starmer, because he's not very tolerant of incompetence, which is why we're doing so well. Look, one of the reasons I am here, and one of the reasons I'm really, because often the people come to me first, and the reason I'm here is partly to listen to the experts as much as anything else. And we've had some great ideas already, and some challenges, I think, for us about what we need to do to deal with the scale of the crisis that's affecting children's healthcare in our country. So let me respond to some of the points that have been raised. I guess the fundamental point I'll make initially is that whether we're talking about children's health generally, dentistry specifically, cancer, or specific conditions or challenges in terms of healthcare, it comes back to the fundamental point, which is unless we tackle the overall crisis in the NHS, we haven't got a chance of really making an impact on any particular part of it. And the single biggest challenge facing the NHS, the single biggest omission from the Sesame Street ABCD statement we got from the Secretary of State for Health last week, was the absence of any real plan for the workforce. And that's why what Rachel Reeves announced yesterday in her brilliant speech as Shadow Chancellor, I would say that, we did rather well out of it, was the biggest expansion of the workforce in the NHS's history is really significant. Doubling the number of medicine places, medical training at universities, 10,000 more nursing and midwifery training places, doubling the number of district nurses qualifying, and 5,000 more health visitors to deal with that gap, because what I hear from health visitors are dangerously overloaded caseloads. What I hear from mums and dads is we're not very impressed with our health visitor. We don't see much of them. When they come, they seem to be in a rush to get somewhere else. It's obviously no fault of theirs. This is the conditions they're operating in. Those ingredients are absolutely central to making sure that we bring waiting times down, deal with the backlog that was at record levels before the pandemic, lest anyone try and claim otherwise, and to make sure that when it comes to particular initiatives, whether around children or continuing cancer strategy or ways for and other areas of healthcare policy, we've got to make sure we've got the people there, otherwise we haven't really got the plan. Secondly, I absolutely take up the challenge about the system. This will be a big part of my speech tomorrow. Doesn't mean you should miss it. If you're nursing a hangover, you should still tune in. I'm not going to give it all away now. We can't keep on pouring more money into a 20th century model of care. We have got to change and modernise the way that healthcare in this country works, so that we deal with the central challenge, I think, that's been identified by Camilla and Matthew, of prevention. Because why is it that we spend so much money in hospitals? Why is it that hospitals are bursting at the seams with queues out the front and delayed discharges at the back? Because we don't get there early enough downstream in the patient's journey. We're not there with prevention, good public health, good diagnostics, lower cost interventions, better for the patient if we get there earlier. We're paying an awful lot of money for very bad healthcare because we're not getting there early enough, and that's because if you look at the NHS as a system and compare it to healthcare systems in other OECD countries, you'll see kind of hospital spending somewhere right near the top. But when you can look at things like investment in public health, primary care, social care, thinking about those delayed discharges, diagnostics, capital spend, we are either down at the bottom or in some cases even lagging behind. And that's bad for the patient and bad for the taxpayer. So at a time when I know there is anxiety out there about the future of the NHS, and there are even some siren voices that are saying, I'm afraid that free at the point of use thing we had in the 20th century, or we can't afford it now in this modern day and age, as if somehow things should just inevitably get worse over time rather than better. It's not free at the point of use that's the problem, it's mismanagement by the Conservatives in government, and it's the model of care, how we organise healthcare in this country, and the need for greater integration as well, which I think when it comes to integrated care systems, I'm very much in favour of evolution rather than counter-revolution. The thrust is right, but we'll be judging them on their delivery, so we're keeping a close eye out on that. And then the other thing I want to pick up in terms of prevention is particularly around, public health, not least because I've upset lots of public health campaigners in the last 24 hours or so, because I've been asked specifically about sort of buy one get one free deals and sort of heavy salt, heavy sugar products and deals. And I've said, look, I'm not tin-eared about this. I'm not going to start trying to clamp down on buy one get one free in the middle of a cost of living crisis. And I've kind of heard through my inbox and on the fringe the breaking hearts of public health professionals who are saying, hang on a minute, look at the evidence. And I just want to sort of really underline this point because it's important. I haven't said not ever. I've been very clear in saying not now. I think if you take the soft drinks industry levy, for example, Conservative policy, let's not forget, I'm baffled as to why, having spent 12 years trashing all of our successes in government, the Conservatives have now started turning on their own. They don't have much to show for 12 years on public health in the NHS, but the soft drinks industry levy has been a really effective measure, both in terms of changing consumer behaviour, reformulating products, but also raising vital money that are being spent on really good public health initiatives, especially for children and young people. So I don't actually think they're going to go through with scrapping the soft drinks industry levy. I think they would have done it last week if they were, and we were sport for choice between terrible speeches from government ministers last week. It could have been in either one of them. But I want to be very clear with people, we oppose that. And just because we're saying not now on regulation, it really doesn't mean not ever, and I'm really keen to follow the evidence on this. And also, I did lay down the challenge to the food and drink industry this morning, emphasising the not ever point. They've got a window of opportunity actually. If they want to persuade me that regulation isn't the answer and we should work in partnership with the industry, or show me the colour of your money and show me your ingredients and show me your responsible ethical approach you're going to take without the heavy hand of state regulation, I'm open to persuasion, but I may not hold my breath. And speaking of holding my breath, it's always nerve-wracking being on a panel with dentists. You sort of start, you don't want to be judged. I mean, honestly, the state of dentistry in this country at the moment, and a bit of self-reflection for a moment. We've been holding the government's feet to the fire on dentistry. We do think it is a bit rich for the government to criticise the last Labour government for the dentistry contract for two reasons. One is reform of the dentistry contract was in our 2010 manifesto, so it's not like we didn't recognise the problem and wouldn't want to change it, but also they have had 12 years to fix this up. I do think we're kind of beyond the point of blaming the last Labour government for things that we could have done better. They've had plenty of time to put it right, but it comes back to my point. It's like asking the arsonist to put out the fire they started. It's not going to happen. So we're holding the government's feet to fire. I am conscious that people are looking to us for further answers on dentistry, and we need to be more ambitious than we have been so far, and I'm absolutely up for taking that challenge on. Matthew, you offered them some really good practical and unfortunately not very expensive suggestions as to what we might do around dentistry, because costs. The challenges I'm kind of working through, and the reason I've not majored on dentistry this week is the constraints I have are of course money and people, and I'm trying to think really carefully about what we can credibly offer in the first term of a Labour government. We're determined to under-promise and over-deliver, and we're not going to be saying 24 hours to save the NHS, because it took longer than 24 hours to break it. It's going to take longer than 24 hours to fix it. Similarly in dentistry, I can't fix all the problems in a single parliament, even if I had the biggest budget and the biggest ambition in the world. These things would take time. So actually we're looking for advice really on what should the priorities be, and instinctively I kind of feel childhood dentistry, children's access to dentistry, and tackling particularly the inequalities, the poverty of dentistry access and supply. But we'd be really keen to work with your Royal College and others on how we come up with that workforce plan that you said that, and I agree we need, as well as some of the low-hanging fruit which might be available to us in dentistry, which is obviously preferable to sugar.
Brilliant. Thank you so much, Wes. Framing the issues there affecting children and young people in the context of that whole NHS crisis, with a particular focus on workforce, and also shining a light on the importance of prevention, not just for health inequalities, but the operational and financial implications as well. Alita, can I hand over to you for opening remarks?
Yeah, apologies for my lateness at another event, but I would love to sort of focus on the lack of support, particularly for teenagers when it comes to accessing mental health care. I fear that we're sleepwalking into a really big mental health crisis, not only because obviously these children with issues are going to grow, and within our NHS system, I think mental health facilities are really lacking at the moment. I will expand in a bit more detail, but also because of this energy supply crisis that we're going through, this cost of living crisis. Before this, during the pandemic, we all heard horrible stories of children who were sharing beds, sharing laptops and mobile phone facilities to do their homework, having to gather in very cold rooms because they weren't able to go to school and access the normal support from staff that they would be able to, and that was particularly challenging on them, and they're still recovering from that. And now we're going into another crisis where parents are definitely, well, they know already that they're not going to be able to afford their energy bills. That stress alone is going to pile on them, not only because, again, they will struggle to access the warm comfort of their homes, to work and thrive as we would love them to, but also because of just the sort of taxing stress of watching your parents struggle in that way. I think, if you've grown up in a single parent background, I've spoken to a number of young children in this sort of situation, you're having to essentially act as a guardian to your parent. That alone is taxing on these young children. And I refer to this really horrifying survey from Young Minds. It's a charity that supports young children, and it found essentially that 67% of parents were extremely worried about the long-term impact of their children because they were not able to simply support them emotionally because of the stress they are going through, because of the responses we're getting from the government in terms of money and funding. And this lack of access is obviously going to have a knock-on effect on their ability to work and their ability to get the grades they need in school to continue to grow. So I just really want to sort of press words on this issue. What really are Labour's commitments on really expanding early support hubs for young people, especially teenagers, because many of them will end up in A&E and they're not often believed by these doctors because they may appear to be functioning, but obviously we know that mental health issues are a lot. So what will Labour commit to support these people?
I can't believe you come in here late and then start asking me these questions. I'm really glad you did, actually, because when you start talking about mental health, I thought, I know because we've got so much great policy, it's easy to overlook. But it's a really serious point, actually. It says a lot about our commitment to mental health as a party, that ahead of all of the great stuff we've started to announce this week, last year at conference, Keir announced a really ambitious mental health pledge, 8,500 additional mental health workers, again dealing with the workforce challenge, which would enable us to provide support in every school to get to that point much earlier before young people reach crisis point. Community mental health support hubs, because I think we're seeing both in primary care and in hospitals, the lack of appropriate and timely mental health support leads to crisis point and overloading of other parts of primary care, but also A&E departments in some really quite harrowing cases and examples that I've been talking to staff about. And you're right that as I talked about this at an event first thing this morning, if you think about where we are in the context of the pandemic, I really think that beyond those who died or lost loved ones and continue to suffer with long COVID, I just think children and young people have been the biggest victims of the pandemic in terms of their childhood development, their education and their well-being. And the two big issues that are raised with me over and above everything else when I go into schools are crime and safety, and kids really worried about going to and from school and feeling safe in their communities. But secondly, mental health and well-being. It is a huge epidemic level crisis, and I think that policy that we have, the pledge we have, it would revolutionise access. I mean, if we can achieve that ambition, which Rachel referenced yesterday in her speech too, of guaranteeing start of mental health treatment within a month, I mean, that really would be revolutionary in terms of access and support, and that's our ambition. And I'm really glad you mentioned it. And by the way, in terms of lateness, I can confess I was not the only one who was very late here this morning, but mine was due to incompetence rather than popularity.
Thanks, Wes, and thanks, Lisa, for so passionately highlighting the importance of good mental health support for young people. Let's take some questions. The best way to do this, we'll do it in batches of 3, and then we'll let our panel go from there. So, in the front here first. Thanks, Wes.
Thank you, panel. That was really, really great. I'm Sarah, the Chief Exec of Asthma and Lung UK. 1 in 11 children have asthma, 1.1 million. It's the most common long-term condition in children, and really great to hear the workforce promises yesterday. I wanted to ask your view on continuity of care. So the biggest single theme on our helpline is lack of access to primary care, people struggling to get access, but we know for so many children that actually a lack of continuity of care in the system is a problem. And in the very tragic cases where children still die from an asthma attack, if you read the coroner's reports, it's often a patchwork of missed opportunities because of fragmentation of care. So I'd just be interested, great to see the workforce commitments. What about continuity of care? And then a quick plea around prevention, something I know Camilla's really passionate about, as are we at Asthma and Lung UK's Clean Air.
Yep.
You will have heard the story of Ella Kissy Deborah, the schoolgirl in London who died of an asthma attack. Her mother talks so passionately about, had she known, had she been aware of the damage that toxic air was doing. So I'd be really interested in your views on clean air as fundamental to good child health, good lung health.
Good questions. Thank you so much. And then we'll take
Thank you, and it's really lovely to be here and meet you for the first time from afar. My name's Farah Jimmy, I'm a GP in North London, but also the chair of the BMA's GP committee at the British Medical. So we really, really welcome the workforce pledges that all the parties put across, and that's great. But if we start training GPs today, literally today, we won't see them for 10 years. So I guess my challenge back to you is to look at what you might be able to offer here and now. What is your retention strategy? And I'll just put on the table, I want to help you with that. We want to help you with that, the BMA. So it's a question, but also an offer for some solutions.
Very good. Thank you. And one more. I can see a hand right over there in the corner, that gentleman.
Thank you very much, and thank you, panel. My name is Philip Moshi. I'm Twickenham CLP's Disability Officer, and I'm also a trustee of a special needs charity. I'm also proud to be a Fabian. One of the main caseloads we have, both in the CLP with children and also at the special needs charity, and Camilla mentioned it, is the lack of therapies for children, but particularly when coming to put together an education, health and care plan, either at first instance or on review. And whereas in our borough, previously it was the council that were delaying on giving money, it is now the health service, the CCG stroke ICS, that are so delayed because of COVID funding or what have you, that children aren't being assessed and they aren't getting their therapies. You said we have to go in early and hard, and that's definitely the experience that parents have with special needs children. The earlier you get in, the earlier you give therapies, the better it is for that child as they go along, and the less money they cost us in the long run. But it's just not forthcoming from the health service and the CCGs at the moment, and I just wondered what how you can make that happen better as the president of the Royal College of Child Health. What you can do, how you can make the CCGs and the ICSs hurry up, really.
Thank you so much. 3 really good questions. Continuity of care and clean air, retention and therapies. Conscious that Wes needs to leave in about 5 minutes, so if it's all right, I'm going to...
Oh God,
yeah.
go somewhere else.
Yeah.
See my step count this week. Anyway, woe is me. On to the answers. Continuity of care, absolutely take your point. I'm really glad you mentioned it in the context of children, actually, because I think sometimes, I say we, sometimes when I think about the importance of continuity of care, I'm thinking about some of my older constituents who are really fed up with explaining or people with ongoing health conditions having to explain over and over again. But I think you make a very powerful point there about children. I mean, we pledged to return the family doctor by putting in some new incentives geared around specifically continuity of care, because the evidence is compelling about the benefits to health outcomes. And part of the workforce stuff we've announced will help to build that kind of capacity for continuity of care. And also the emphasis you'll hear from me tomorrow on patient choice. It's about recognising that for me, continuity is not particularly important. I just want ease, speed of access, to give me a bit more freedom and flexibility to do that. I get out your hair, get out your way, and create a bit more time and space to provide continuity of care in those cases where seeing the same person, building that relationship, building the understanding and the right diagnosis and support can make a really profound difference. I agree with you completely. As I do on prevention as well, and we've got to do much more around the social determinants of health. Big emphasis from Labour on health in every policy. The prevention agenda, by the way, is the one Keir asks me about more than anything else. It is the thing that he cares about more than anything else in relation to health policy, and I agree about the need for a Clean Air Act and about cleaning up our air. And it's one of the reasons why I think Sadiq has been absolutely right to be so politically courageous in taking on the dirty air of London against, I'm a suburban London MP, not always popular, but we benefit from the clean air. Farah, absolutely bite your hand off with the offer of help on retention. I really wish I had a big government department full of civil servants available to me. I have some highly capable and competent staff who are extremely overworked. So getting advice and support from the Royal Colleges, from the BMA, from the think tanks is really, really valuable, and you've seen that reflected in the policy we've announced this week. So let's talk about that. I've been banging the drum particularly on the GP pensions issue and the absurdity of losing people early for no other reason than the financial disincentive to stay on. I actually want to get people back in as well as retaining. I want people to come back in. So let's talk about what we can do, because it's not just about more, it's about serious workforce planning, and I take you up on your offer, thankfully. And finally, Philip, I know you've directed your question to Camilla, because she's going to sort it all out. I absolutely take up your case about EHCPs and the fact that parents really feel they have to battle the state and battle the health service to get support for children. And often, it's hard enough trying to do the best for your children who have those additional needs, but to have to battle the state on top of it is just really unacceptable. And as Naib Evans said, the language of priorities is the religion of socialism, which is why we need a serious plan for the NHS with the right priorities. And if we don't have as our priority those children with special educational needs and disabilities, we really need to rethink our priorities.
Brilliant. On the dot for when you need to leave. So thank you so much, Wes. Camilla, I'm going to go to you next, if that's all right. Take on those questions in whichever order or preference you want.
Right, well, so the therapies questions is a really interesting one, and EHCPs. I think, there's a huge amount of unmet need in relation to children who may or may not have additional needs and in need of therapies. And I think it's even entry into the kind of diagnostic side of things that's a challenge at the moment. And I think, autism is a particular issue, and there's huge discrepancy nationally around how long you wait as a family for your child's autism assessment, and that, there's some awful stories. I think the good news is there's a real intention and will within NHS England to try and understand the size of the problem. So I think, we've been lobbying for ages around the hidden waiting lists in community child health, and actually it is finally getting some focus. And so, but it's kind of boring, because it starts with having to just understand the size of the problem before you can start determining interventions. So I think we're still at the early phase, but I think genuinely there is more and more recognition about the size of the problem in kind of community child health. The problem is that it's sort of Cinderella part of children's health. It sits out in local government sometimes and so on, and so there's been a lack of investment and a lack of intentionality around service design. But again, if the ICSs lever the advantages that we hope they're going to do, it ought to iron out some of these problems. So we're kind of trying to use the mechanisms we've got at our own hand to kind of lobby and keep a light shone on this. So completely take your point. Continuity of care and clean air. Well, clean air, you're preaching to the converted, and we'll keep championing the cause. And Bruce and I are on our bicycles on Thursday morning, cycling around London hospitals, raising awareness around clean air for children. We'll keep doing that. Continuity of care is a really challenging issue, and I'm not going to rehearse what Wes has said, but we should also think about some of the digital possibilities there. And we've been really, really pleading for a digital child health record. So that's a record that starts at birth. We all know the kind of red book that families have got at the moment. But seriously, we ought to be able to move into the 21st century. Now, I recognise that there are issues around data poverty, but accepting that point, if we could have a child health record, you started at birth and then became your parent-held record and then child health record, instead of having to tell your story every time you interact with health services, it was all there. I think that would address some of the continuity issues, but I accept the human touch is important as well.
Brilliant. I mean, that's really helpful. Thank you, Camilla. And I was thinking, Matthew, I don't know if you wanted to come in on retention around the dental workforce.
Yeah, I mean, I think your point about the clean air, and actually had the parent known about this, then the consequences might have been different, is also is really important for dentistry, as I've mentioned, because, as I said, the stats are dreadful, but actually we know they're dreadful within the profession. Camilla knows they're dreadful because I've told her. I've just told all of you here. But if we went and sat in Albert Dock, actually no one would know. And so if the public messaging was different, would the outcome to child oral health be different? I don't know. We don't have any evidence for that, but I suspect probably it would be. And so I think, each of us need to go and tell 20 people that the main reason for a child to be admitted to hospital is to have teeth taken out. Whoever you tell will say, oh my goodness, this is dreadful. And then they might start thinking about, alternative foods and healthy choices, etc. In terms of dental access, I suppose, and as a consequence of that retention within the NHS, I think that it's not just a case of more dentists, that is an issue, but it's about training and training opportunities for those dentists. Treating children is not easy as a dentist, because they wriggle around, they might scream and whatever. You need additional training, and there needs to be investment in that training in order for these dentists to be able to provide that treatment. There needs to be investment in things such as having oral health educators in those practices which have got the highest need. So you train a dental nurse to become an oral health educator who can then, apply fluoride to the teeth if necessary, or speak to the patient and the parents about alternative choices in terms of diet and lifestyle, etc. These are very quick things that we can do to try and prevent this problem.
Brilliant. Thank you, Matthew. Elika.
Yeah, and just to talk about continuity of care from a wider perspective. I mean, Therese Copley unveiled her ABCD of what she hopes to achieve as health secretary. We sort of heard of this similar strategy in terms of rolling out better access for people to simply phone into their GPs and build that relationship so they can feel comfortable disclosing, even issues like domestic abuse, for example, going to your GP for your first point of call. But we've heard this from the Cameron era. I think he had like this £50 billion plan, which was, wholly based on improving telephone systems, essentially, which again we've heard only just a few weeks ago. And I think we're just at such a critical point where Labour really needs to start coming on the offensive. It's not just enough to simply criticise the bare bones of the government strategy, but to really outline and detail exactly how they will ensure that people of this country will be able to maintain these really important relationships, so that issues are seen much quicker, and that will also help GPs who will not have to be jumping in when it's too late and people going to AIM and so forth. So.
Brilliant, thank you. The age of the fax machine in NHS is over. Long live the telephone. I think we've probably got time for 2 questions, and then I'll hand over to the panellists to give their responses to those and say anything they want to in terms of closing remarks. So let's go to this gentleman here.
Hi,
just wait for the microphone.
Thanks. David Eardley, I'm a paediatrician at Alder Hay Hospital. So my patients basically can't get a dental appointment, so a lot of them can't, but it's trivially easy for me to do so privately, to go and see someone so that he can charge me £4,000 for whitening and straightening, and leave the children to reach an emergency point where their teeth are then going to be taken out by a hospital dentist who earns a lot less than he does. So how are we going to encourage, incentivise, compel, otherwise change the culture of dentistry so that they are encouraged to see children? And secondly, sorry, I'll be as quick as I can, but the Royal Liverpool and Alder Hay Hospital both were built with fewer beds than their predecessors, and that was on the grounds that community services were then going to increase. But the fact of the matter is community services haven't increased, every Friday if I'm on call, I cannot actually do anything in the afternoon because my phone doesn't stop ringing for GPs who are petrified that they've got a patient that they need to admit to hospital who they wouldn't have had to do, but for the fact there's no community service over the weekend at all. And then after I've dealt with that, I have to go to A&E to clear the backlog of people who just turn up to A&E because they can't get a GP appointment, which then results in me not seeing the patients in the fewer beds. So altogether, it just means that people are sat in beds not necessarily being seen, and there are fewer beds for them to be sat in.
Brilliant, thank you. And then this gentleman, sorry. No, stay there, Audrey. Thanks.
Thank you. I've got a double interest in this. I'm Luke John Davies. I'm on the Fabian Society NHS. I'm also the Policy and Public Affairs Officer for the Royal College of Surgeons of Edinburgh. So sort of your equivalent, or I work with very closely. I'm actually here to speak actually as a stepfather. So I'm just going to pick on Camilla and follow the rest of the room in that. My stepdaughter is autistic. She's very obviously autistic because she has a conversation with just about anyone. And she was 18 months into a CAMHS referral in Nottingham when we moved house. And because we crossed local authority borders, we were told we had to start the process all over again, and that we would be a minimum of 4 years on a waiting list. And she was 7 when she started, so she would have been on a waiting list for more or less half her life before she got a diagnosis. That problem was solved in a way, because I actually lost my grandmother in the pandemic, and I used the inheritance to go private, and it cost £2,000 to get a piece of paper to say what everybody who had a 5-minute conversation with her could see. So my question is, my first part of my question is, how do we make sure those things cross borders, as well as dealing with those time discrepancies as to how long it takes? The other part of the question is, how do we upskill the people who deal with these children every day? Because although I say everybody could see that, she is at the only primary school in our area that has a dedicated SEND professional. The reason the school has that is they got a grant from West Bromwich Albion Football Club to pay for an SEND professional because the state couldn't. But when we told him that this was coming down the line and that he would have to respond to this, his response, and I will quote him directly, was, "She can't possibly be autistic, she's chatty." So this is a dedicated SEND professional. How do we make sure that this, people like that who are dealing with these children day after day actually have the skills to do the job that they're supposed to do?
Great, thanks LG. A small challenge to our panellists, in 30 seconds, if you could answer the issues with the dental workforce and SEND provision. So I think, Matthew, if you go to you first to answer that dentistry.
So your comment is, you're not alone. 8 in 10 NHS practices are not accepting children at the moment. But I think there is an appetite within the profession to help these children, and I think the way in which we do that, which can be done in the short term, is to utilise the dental team more effectively. Dentists can do one thing, the dental therapists can do something else, the dental nurses can do something else, and it's about investing in opportunities for dentists to be able to train in paediatric dentistry more easily so that they can deliver the care that is required in their local area. And I think that's what it is. It's a little bit of, it's about working out how we change training within dentistry, how we redefine the roles of the dental team, and how, therefore, then we can make it more effective for these children to be seen appropriately by the person that they need to be seen by.
I'm really sorry to hear your story, but and sadly, you're not alone. We hear these stories, every day from all around the country. And I think children with disability really are at the sharp edge of actually everything we're talking about here. And services are not currently designed to kind of interact comprehensively to support children to flourish with disability. But to your point about autism assessment and diagnosis, I can't comment, I'm afraid, at all on the moving from CCGs, etc., other than, I completely acknowledge the distress that must cause. But I think the autism assessment is really in sharp focus now. It is desperately in need of a complete revamp. And I think there's some interesting pockets of new ways of working in diagnosis around autism assessment, and taking it out of the hands of how it's traditionally delivered, which is through community paediatricians, and thinking about the wider workforce. So it keeps coming back to thinking innovatively, thinking about the wider workforce. You kind of got to give people headspace to try new ways of doing this. So I'm confident it will improve, but I completely acknowledge your story, and I'm sorry about that.
Thank you, Camilla. And then Alita, just over to you for closing remarks.
Yeah, that story was really awful to listen to, and I've heard similar stories over my time as a journalist, my short career. But I must say that there have long been issues with SEND provision. The news reports just state that. I think just a few weeks ago there were parents protesting outside a local school, essentially, begging their council to just get involved and simply try and monitor how this provision is being rolled out, because essentially the government are just not listening at the moment. And I think what we can hope for under a Labour government, I'm not sure about a Liz Truss government, is just more funding within this sector, but also to somehow involve teachers and support staff who will know these children a bit better, to somehow monitor how they're getting on, their progress, their behaviour, their health. Because I think that would help things move on a bit quicker, and they can also go to the GP and so forth. But I think until then there's just too many fragmented parts that are moving and not enough money in circulation.
Brilliant. Thank you so much, and thank you everyone for staying a little bit over time to make up for the late start. If we can just give one final round of applause to our brilliant panellists.